So this is absolutely crazy. As you guys know, I'm a big Tari Eason fan. I think this guy's got great defensive potential. First off, T's and P's to him, his family for what they're going through. So Tari Eason this season, it's been an injury-riddled campaign for a guy that had shown flashes of taking that next step. Really, really fun guy to watch, especially if you're a Rockets fan. And a lot of teams in the league know this. All right, this is a guy that a lot of good teams, contending teams, were trying to pry off of the Rockets' hands. And this is what we're hearing from the Houston Chronicle. Tari Eason's second NBA season has been hampered by an injury since the preseason, often delayed as he tried to come back, is now over. Eason will have surgery to treat a benign growth on his left leg Monday that will keep him out for the next 4 months. Rockets coach Ime Udoka said on Saturday, quote, he had obviously been going through some things through the year and had a benign growth on the shin bone, the tibia, I think. Took that blow early in the season, flared up. He played through it with some pain, never had a chance of fracturing. It was a pain tolerance thing. Once the pain got too high, he shut it down, end quote, Udoka said. Now, from my limited research, I am a journalist for, Hoops Hype, USA Today, and I'm a master's student at the University of Miami. Got journalism, gonna probably be a professor while I do reporting stuff. And first, hit that like and subscribe button to help support the channel. I do need to upload these interviews that I've been meaning to upload. So the DeMarcus Cousins, I think, is up there, but the Lance Stevenson and Jermaine O'Neal will come out. So will Spud Webb. But let's continue the video. Hit the like, subscribe button. Follow me on X, Twitter for updates. Now, link in the description. Now, the whole thing with Tari Eason and this benign growth on shin bone. What does that mean? Okay, so benign bone tumors are what they're non-cancerous growths on the bone, and they can cause pain allegedly, or they can keep you from moving parts. So clearly this is one that's giving him pain. So basically from what I'm seeing is that either it can be a benign or harmless lump that could be caused by either a cyst, warts, abscess, and they can also be caused from trauma from an injury. Then there's also a kind of like a red round lump, and they're not as the one that I'm seeing is that this bump is called a tibia tuberosity, which is where the tendon from the kneecap inserts, and this is more of like a congenital thing right there, the one that I'm reading. And I'm going to take a screenshot right here to give you guys an idea of like kind of the stuff that like he could be dealing with. So this is like worst case scenario, I guess, is bone cancer, which I doubt is the case. I doubt what's happening. If it is happening, holy crap, his career would be ending, right? And right here, it's on the screen now, guys. That's bone cancer. I don't think that's what is happening. What I think is happening is there's this one, which is like non-ossifying fibroa. Again, not a doctor, ladies and gentlemen, not a doctor, just some guy who's just taking what we're seeing on the internet and just reading that this seems to be like some kind of like fibrous tissue where the thigh bone and the tibia kind of like, it's not cancerous and it doesn't like metastasize, which is like it doesn't spread to the other parts of the body, and it happens to like 30 to 40% of people under the age of 20 have a chance of getting NOF. It's just like a benign, non-cancerous bone tumor, and there is no cause. This is one of them that I was looking at that felt like could be the case, but it's basically like this kind of like a growth. And there's other ones where I've seen like it could be like super small things too, like just like a little like piece of bone, okay, that like naturally just grew there, like just could be like calcium deposits. Sometimes I've seen, like one time I covered a case in Kansas where this kid had calcium deposits occurring on both of his eyes, and he was like slowly becoming blind because of it. And like this typically would happen to people like in like old women in the age, in like at their old age, and he was like 10, 12. Terrible story. Here is this one that I was personally thinking, the tibial tuberosity, which again, it seems like this is a great picture I just found for us. So this is what I think it is. It seems like it's some sort of like rubbing could be occurring, and this is like at the way. So when the knee gets like the kneecap and the tibia, I believe it is, when they attach, this is what I think it is. This is what I've been thinking. Something in that area. And again, it's the round elevation from the bone, I guess the bump. So it's the elevation of the anterior aspect of the tibia. So what it does, it makes things such as running, kneeling, stair climbing just painful. If the non-surgical treatment options are activity modification, ice, pain relieving medication, stretching, PT, and I don't know. So it can be like separating growth plates. Maybe that's it. I'm not a doctor, but if anyone knows, let me know.